Hi, Chris. I'm Claire. I'm going to be your OSCE assessor today. You doing okay?
Yeah, very good, thank you. You?
Good. Okay. So just to start with, obviously, we'll just go through a little bit of housekeeping, how it's going to work. Obviously, if you've got any questions, let me know. So just to confirm, I have your participant consent form here. So that's the same person. They're still happy to come in and be videoed, and they've documented that. Yeah.
Yeah.
And good. And you've sent me through the make of your spirometer, so I've had a look at that. So to double check the guidelines, and just to confirm, you said that you want to share your screen with me. So you're going to show.
I'll show you the screen. Yeah.
You're going to show me the screen. Okay. So what's going to happen is the first bit will be, sort of a bit of a demonstration from you showing me how you prepare the room and the equipment. If you miss anything, you can try and follow up, or I might ask you a couple of questions just to clarify things. Then what I'm going to ask you to do is tell me again how you prepare your patient for the testing. At that point, you can go and get your candidate, and then you just run through it as you would do on a normal, as a normal patient in your everyday clinic. During that time, I won't interrupt you unless I see anything safety-wise that I'm concerned about. So you just run through as you would. When you're happy and when you feel like you've completed the session, then you can send your participant away. And then again, maybe I'll ask you a couple of follow-up questions, or again, if you think you've forgotten anything, we can just talk through it then. And then at the end, I'll ask you a couple of technical questions about the performance of spirometry. Is that all okay?
Absolutely fine. Yep, no problem.
Yeah? Are you happy to begin?
Yes, I am.
Fabulous. Okay, so first of all, can you just talk me through how you would prepare your environment and your equipment before you perform spirometry?
Yep, so I'd make sure we're in a quiet, well-ventilated room with no distractions. I would make sure all the surfaces are clear and clean, and I'd make sure I've got my hand gel or sink nearby. So if we don't have a sink in our room, so I'll be making sure we've got the hand gel available. I'll then prepare my machine by doing the verification checks as per my manufacturer guideline.
Okay, can you show me how you do that?
Yep, so I use a 3-litre syringe. Our machine asks us to do it one flow first and then repeat it using 3 different flows. So I connect the spirometer to the end of my syringe, and I just pump it through at the same flow rate to begin with. I'm looking for it to be within range of 3% of 3 litres, so 2.91 litres up to 3.09, which this one is at the moment. So I'll then just switch to the 3-flow verification. And again, I'm checking that's within 2.91 litres to 3.09. And all of those strokes fall within that range. So I'm happy with the calibration.
Okay, good. So if your spirometer had failed calibration, can you talk me through some of the steps that you might take?
Yep, so I would first double check the ambient conditions of the room, make sure that they're reading correctly on the machine. I then repeat the verification checks again, just to see, and if it was still out of range, I maybe try it one more time, but if not, I'd be contacting the manufacturer to come and have a look at the spirometer, but I would take it out of action, so I wouldn't use the spirometer if it was coming out of range.
Okay. Okay, so can you talk me through how you might get the equipment and the patient ready for testing?
Yep, so I'd make sure I've got my request form for the test from the referrer with patient details on. I then input the patient details into the system. Once that's ready, I'll get any medications that might be required for the test if it's a reversibility testing, and then I would bring in my patient. I would confirm their identity with 2 different methods. So we tend to use date of birth and the first line of their address. And once that's confirmed, I'll measure height and weight. Our height and weight measurement actually is outside the room because we only have one that's shared with other rooms. So yeah, we would do that and then bring in the patient. Okay.
So can you talk me through how you would measure height and weight?
Yeah, so we would ask the patient to remove their shoes and any heavy clothing and anything heavy out of their pockets. They would stand feet together against the back of the study monitor, standing up nice and straight, looking straight ahead, and then measure from the top of their head. And then they would stand onto the scales, like I said, with no heavy items in their pocket.
Okay. Okay, that's fine. So do you want to go and get your participant, and then, as I say, from the point that you come in now, just continue as you would for a normal patient. As I say, I won't interrupt unless I feel that I need to. And then when you're happy, when you've completed the session, let the participant go, and then we can catch up with anything.
No problem. Thank you. How are you feeling today?
Good, thanks.
Yeah, good. So can I just confirm? Thank you very much. So hopefully you know you're here for a breathing test today. The breathing test is called spirometry. We're looking at how big the lungs are and how open your airways are. I'm going to just go through a few safety questions first, if that's okay. So any unusual chest pains recently?
No.
Not been coughing up any blood in the last few days?
No.
Any recent surgery on your eyes or chest?
No.
No. Hopefully no recent heart attacks or strokes?
No.
No. Or any aneurysms or embolisms?
No.
No. And have you taken any inhalers today?
Yes.
Okay. Which ones have you taken?
Foster and tiotropium.
Lovely. And what time did you last take those?
About 8 o'clock.
Thank you very much. Okay, I'm feeling well enough today to do the test.
Yeah.
Good stuff. Okay. So the test is split into 2 manoeuvres. Okay. The first manoeuvre is that you can get your slow vital capacity, which is just your lung capacity. What I'll ask you to do is hold the handle here. Place these pegs onto your nose to seal off your nose. Feet flat on the floor, sitting up nice and straight. Taking the biggest, fullest breath that you can. Once you're full, I want you to pop your teeth and lips around the tube, create a nice tight seal. It's a long, steady blowout until you're completely empty, and then come off and relax. Okay, but I'll talk you through it as we do the test. Okay. Have you got any questions at all? No. So if you hold the handle there, pop the peg onto your nose, and then when you're ready, big full breath in onto the tube, nice tight seal, and blow, just steadily blow. Brilliant. All the way out to empty. Well done. That's great. Keep this going. Keep going until you can't do it anymore. Keep pushing, keep pushing. When you're completely empty, you can come off the tube. Well done. You can take the pegs off to relax. Excellent. Well done. Feel okay?
Yeah.
Good. That's really good. Well done. We're just going to have a little rest, and then we always repeat the manoeuvre a few times. Okay.
Okay.
Feel okay to do another one?
Yeah.
So if you place the peg on your nose, nice and straight, keep flat on the floor, and when you're ready, take the biggest breath in you can, all the way up to full, onto the tube, and steadily blow all the way up. Good, and keep that going, keep it going, nice and gentle, doing really well. Keep pushing. When you're completely empty, you can go off the tube there. Well done. Take the pegs off, give yourself a rest. Well done. Feel okay?
Yeah.
Good. Well done. Really good. So those 2 are really good. So we're going to do the same again. We'll try and get 3 that are nice and consistent. So you feel okay? Pop the peg onto your nose. A really big full breath in, onto the tube, and steadily blow. Fantastic. All the way to empty. Well done. Keep that going. Keep it going. Almost there. Doing really well. Keep pushing and squeezing. And you can come off the tube there. Well done. Catch your breath. Feel okay?
Yeah.
Well done. Very good. I'm just going to review those attempts there. Okay. Fantastic, thank you very much. So we're going to move on to the second type of manoeuvre now. So this one looks at how hard and fast you can blow out. Okay. What I'll ask you to do is, again, feet flat on the floor, sit nice and straight, peg onto the nose, take a really big full breath in. This time, go onto the tube and blow out as hard and as fast as you can. And I want you to continue blowing all the way till you're completely empty. Once you're empty, you can come off the tube. Okay. So I'll talk you through it as you do it.
Good.
You feel ready? Peg onto your nose. Really big breath in. keep going, keep going, keep going, almost there. Doing really well, Matt. A few more seconds, and when you're empty, you can come off the tube and relax. Take the peg off. Catch your breath. Well done. You feel okay?
Yeah.
Good. Okay, so that's a pretty good first attempt. One correction we're going to make on the next attempt. Once you took a big breath in and went onto the mouthpiece, you just delayed slightly before the big blast out. Okay, so what I want to try and do is, as soon as you're onto the mouthpiece, blow out straight away as hard and as fast as you can. Okay, but I'll talk you through it again the second time.
Okay.
So whenever you're ready, feet flat on the floor, nose peg on, sitting up nice and straight. Take a big breath in first, and blow. Good, and keep that going. Well done. Keep pushing and squeezing. Do really well, Matt. A few more seconds if you can. When you're empty, come off the tube and relax. Catch your breath. Well done. Very good. You okay?
Yeah.
It's hard work, I know, but that was really good. But on the second attempt, much better with the technique, much sharper and urgent when you got onto the tube. And we're just going to do a couple more to try and replicate that second attempt that you did.
Yep.
So whenever you feel ready, pop the peg back onto your nose, set up nice and straight. Take a big breath in first, and keep it going. Really keep pushing and squeezing. You're doing really well, mate. Keep this going. Keep it going, and you can relax there. Come off the tube. Take the pegs off. Excellent. Good. Okay.
Yeah.
Well done. Have a bit of a rest in between these next attempts. So those two are, the second two are nice and consistent. So we're just going to go for one more. Okay, and as long as that's the same as the others, we can finish it. So you feel recovered enough, okay, you can take your time, but when you're ready, you can pop the pegs back onto your nose. Nice and straight and informing. Now that big breath in first, and blow. Good, keep going, keep going, keep going, doing really well. Keep it going, almost there. A few more seconds, and you can relax there off the tube. Take the pegs off your nose. Well done. How are you feeling?
Yeah.
Okay, well done. And we just check the results that we've got there to check we've got everything we need. Yeah, excellent. That's very good. So that's everything they've asked of me today. So I'll put that together in a nice report and save it across for your doctor to review it. Okay, I'll take them from you. Thank you very much.
Thank you.
No problem.
Okay. Okay, so can you just show me the results from your slow first, please?
Yeah.
And can you talk me through why you were happy to stop the
Yeah,
session
so
there?
I'm happy that I achieved 3 technically acceptable manoeuvres. So they were 3 manoeuvres without any errors. So the patient was nice and full, and then steadily exhaled continuously without any obstructions until they were completely empty. And then for reproducibility, I wanted my best 2 slow VCs to be within 150 mils.
Okay.
So I'll just show you those on the screen.
Don't worry, technical issues are fine. Okay.
So
All right.
you can see those.
Yeah. Yeah. So talk me through why you're happy.
Yeah. So the first 3 were absolutely fine. So we've got 478, 478, and 486. So all with the top 2 are within 150s, and I will report the highest 4.86.
Okay, good. So can you show me your force now? So can you start off by showing me the loops first? And talk me through what you're looking at.
Yeah, so these are my flow volume loops. So on the first attempt, you've probably heard me say I detected an error. So there was a slow start or hesitation. So the loop leans over quite significantly to the right. So there's a bit of a delay. What I want to see is this nice sharp rise to peak there. So I just rejected that one and corrected the error with the patient, and then achieved 3 technically acceptable attempts. That's 3 with that nice sharp rise nice peak and a steady uninterrupted decline down to empty.
And then if you show me the numbers.
Yep. So
And again, talk me through that.
Yeah, so I've got all 4 attempts there. So I've rejected the first one because it wasn't technically acceptable. So then I've got 3 technically acceptable attempts. All 3 have a peak flow within 40 of the highest. So it's 748, 738, and 732. I then would want the top 2 FVCs to be within 150 mils, which they are. So I've got 476 and 472, and I will report the highest, as with the peak flow. And then from the top 2 FEV1s, I would like them to be within 150 mils. That's 378 and 374.
Okay, perfect. Any other criteria you're looking for?
I would like my SVC and my FVC to be within 150 mils of each other as well, to show good comparison between the 2 manoeuvres, which they were. So I got my best FVC was 476, and the best slow VC was 486. So within 100 mils. So I'm happy with those.
Perfect. Okay. And just thinking back to obviously from the start when you got the patient in through, is there anything that you think you might have forgotten to do or want to clarify anything which you would normally ask? So
I would normally ask their smoking status. So
Okay.
if they were still a smoker, if they previously smoked, and if they had smoked when they last had a cigarette, and I'd record that in the report.
Okay. Cool, Viva part of the session. Okay, so I'm going to ask you some questions. We'll go through them all. If you want to clarify anything later, then that's fine. Okay. So why is it important that you use a bacterial viral filter when doing spirometry? So we use a bacterial viral filter for infection control precautions. So it will protect the patient from breathing in any bacteria from the machine, and also protects everybody in the room, including the person performing spirometry, because it will stop any bacteria getting into the room or the machine. Okay, good. Okay, so that's the end of your assessment. So well done. You can just breathe now. You got through it. Is there anything else that you wanted to go over, clarify, anything you might have missed, or you're happy enough with everything? No, that's fine. How long until I find out my result? Yep, so I'm just going to complete all your paperwork now and documentation. I'll send it back to the admin team, and they'll let you know within 5 working days of your result. That's great. Okay. Thank you very much. All right, well done. Take care. Bye-bye.